Good morning, everyone. Welcome to the Multnomah County Board of Commissioners and our regular board meeting. Today is Thursday, July the 23rd. The health and safety of our community and our staff members are at the forefront of our minds as we continue to navigate county business in the light of the COVID-19 pandemic and everything else. In accordance with the declaration of emergency announced on March 11th and extended by the Board of County Commissioners on July 2nd, today's meeting is being held virtually. To align with physical distancing guidelines, some rules associated with Board of County Commissioner meetings will be temporarily altered. Today, we will be suspending public testimony on non-agenda items. Written testimony on agenda items has been accepted via email. Please mute your mic when you are not speaking, and when you're presenting, make sure to unmute your mic and check that your camera is on. Presenters, please remember that the public may be listening via phone, so please state your name before your presentation or before answering any questions. May I have a motion on the consent calendar?
So moved. Second.
Commissioner Jayapal moves. Commissioner Stegman seconds. Approval of the consent calendar. The board clerk will now take a roll call vote.
Thank you. Commissioner Myron?
Aye.
Commissioner Jayapal?
Aye.
Commissioner Vega-Peterson?
Aye.
Commissioner Stegman?
Aye.
Chair Kafori?
Aye, the consent calendar is approved.
R1, ratification of tentative agreement between Multnomah County and the American Federation of State, County, and Municipal Employees, AFSCME, AFL-CIO, Local 882 Physicians Unit, for a one-year extension to the collective bargaining agreement.
So moved. Second.
Commissioner Vega-Peterson moves. Commissioner Stegman seconds. Approval of R1. Morning.
Good morning, Chair and Commissioners. My name is Steve Herron. I'm the Labor Relations Director for Multnomah County. And this time I managed to wait with my introduction until actually after the motion and second. Small victories. The physician's contract was up this year for ratification for successor negotiations. And as you may recall, it was one of the last that we took up. We took up the Local 88 general contract first, and then we also took up the FLAPO contract, but we had waited on the physician contract for a variety of reasons. We did take it up and have 4 bargaining sessions between May 18 and June 15. And ultimately, the parties reached an agreement for a one-year extension of the contract under the circumstances with the particularly the COVID-19 pandemic. It was mutually beneficial to simply do a one-year extension and bargain in detail next year. So I want to thank some folks for their work on this contract negotiation. On the physicians bargaining team, Dr. Elaine Marcus, Dr. Jeffrey Barrett, and Dr. Filza Akhtar represented the unit membership. Percy Winters Jr. Represented the local, and Evan Pullman and Celeste Jones represented AFSCME Council 75. And I appreciate their hard work at the table in this negotiation. On the management side of the table, Dr. Amy Henninger, Debbie Smith in HR, Aaron Murphy in HR, Trista Zugel-Benson in budget office, and then Don Schatzel from health were on the team, and Caitlin Purcell from my office, and James Apoka was our chief spokesperson at the bargaining table. And I want to thank them as well for their hard work in getting us to a settlement. With that, if you have any questions, I'm happy to field them.
Great. Thank you so much, Steve. Marina, did we receive any public testimony on this item?
No, Madam Chair.
Wonderful. I'm going to call on the commissioners by district to see who has questions or comments, and we'll start with District 1. Commissioner Myron.
No questions. Thank you for the efforts of everyone involved.
Commissioner Jayapal.
Thank you, Steve, and everybody else on the team. No questions.
Commissioner Vega Peterson.
Thank you, Chair. No questions. Just, thanks to Steve and his team and all the folks that asked me who worked to get this done.
And Commissioner Stegman.
No questions. Thank you, Chair, and thank you, everyone. Well done.
I will add my thanks to all the parties who participated in this. And now, if Marina, the board clerk, would please take a roll call vote.
Commissioner Myron,
Aye.
Commissioner Jayapal,
Aye.
Commissioner Vega Peterson,
Aye.
Commissioner Stegman,
Aye.
Chair Kafori.
Aye. The agreement is approved.
R2, ratification of tentative agreement between Multnomah County and Federation of Oregon Parole and Probation Officers, Huron Federation, for a 1-year extension to collective bargaining agreement.
So moved.
So moved. Second.
Commissioner Stegman moves. Peterson seconds. Approval of R2. And welcome back, Steve.
Thank you, Chair and Commissioners. Twice in a row, I didn't interrupt. My name is.
It only took you 5 years to learn this. How do you guys?
I do eventually learn. My name is Steve Herron, and I'm the Labor Relations Director for Multnomah County. I'm here before you today regarding the FAPO, Federation of Parole and Probation Officers collective bargaining contract. Similarly to what I was saying in regard to the physician contract, the parties in this particular negotiation recognized that under the circumstances with the COVID-19 pandemic, that it was bilaterally beneficial to do a 1-year extension of the contract and enter into negotiations in earnest next year when we have a little bit a clearer and more stable environment, hopefully. This one, the parties had actually gotten started quite early. We had our first meeting on January 6th, and then, as you can imagine, had several meetings, and then we hit the circumstance with the pandemic occurring. The last bargaining session was on June 29th, so not that long ago. And over the course of those 5 sessions, we did conclude that the 1-year extension made sense. I want to thank the FAPO bargaining team, Pat Brisesco, Leah Beckworth, Jennifer Brissenden, Jay Burke, Joel Gatto, Tasha Vandenberg, and Chris Whitlow, and their representative, Rhonda Fendrich. On the management side of the table, I want to thank Lisa Lewis, John McVeigh, Shante Ontero, Denise Pena, Jay Scroggin, Stuart Walker, Wendy Jackson, and then Jeff Renfro from Budget, Caitlin Purcell from my office, and Shelley Kent, who was the Labor Relations Manager, who was first chair and managed our negotiations at the table. With that, if I can accept that or take any questions you might have.
Thanks, Steve. Marina, did we receive any public testimony on this item?
No, Madam Chair.
This time, we will start with District 4 for commissioners to ask questions or comments. Commissioner Stegman.
Thank you, Chair. No questions. Again, gratitude to everyone that was involved, and thank you, Steve.
Commissioner Vega Peterson.
Nope. No questions. Just my thanks.
Commissioner Jayapal.
And again, no questions, and thank you.
And Commissioner Myron.
Ditto, 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 ditto. Thanks.
Thank you. And Marina, would you please take a roll call vote?
Yes, Commissioner Myron,
Aye.
Commissioner Jayapal,
Aye.
Commissioner Vega Peterson,
Aye.
Commissioner Stegman,
Aye.
Chair Kafori.
Aye. The agreement is approved.
R3, Hawthorne Bridge NATO ramp signal installation intergovernmental agreement.
So moved.
Second.
Commissioner Vega Peterson moves. Commissioner Stegman seconds. Approval of R3.
Good morning, Chair Kafori, Commissioners. My name is John Hendrickson. I'm the Transportation Services Manager in the Transportation Division of the Department of Community Services. I'm here this morning to request board approval of an IGA between Multnomah County and the City of Portland to construct a new signal at the top of the ramp at the west end of the Hawthorne Bridge that connects NATO Parkway to the Hawthorne Bridge eastbound lanes. This project is part of the Better NATO Forever project that the city is building to improve pedestrian, bike, and auto movement along NATO Parkway. The goal of the signal installation is to reduce backup along NATO Parkway during rush hour that interferes with streetcar operations several blocks away from the bridge. The city will construct a new signal attaching to the Hawthorne Bridge railing at the top of the ramp from NATO and rebuild the bike and pedestrian facilities near the ramp. The improved pedestrian ramps will comply with current ADA standards. The county will oversee and inspect all construction work on the bridge and ensure that it meets the quality requirements of the project plans and specifications. The county has also designed and will install an interface to connect the new signal into the operating system of the Hawthorne Bridge. The new connection will allow the bridge operator to control the signal during the bridge lifts and maintenance operations. As part of the IGA, the city will reimburse the county for the cost of working on the project. Transportation staff have worked closely with city staff and their design consultants for more than 3 years to design and plan this new signal installation, and reviewed all electrical and structural connections to the bridge and its control system to ensure that there will not be a negative impact to the bridge from the project. The city has bid the project and select a contractor for construction. If the board approves the IGA, construction of the signal will begin in January of 2021. And with that, I'm happy to answer any questions that you have.
Thanks, John. Marina, did we receive any public testimony on this item?
No, Madam Chair.
Great. Well, I will start with Commissioner District 1, Commissioner Myron. Questions or comments?
I do not have any questions and appreciate the work and the presentation.
Commissioner Jayapal.
No questions. Thank you, John.
Commissioner Vega-Peterson.
No questions. This is just one of those things where we work very closely with the city, with our bridges and the streets and the various, jurisdictional authority on both those things. So thanks for all the work, John.
Commissioner Stegman.
Thank you, Chair. One question, John. So you're saying that the city of Portland is paying for this signal?
Yeah, this is John Hendrickson. Yes, they will pay for the signal.
Awesome. Great. Thank you. Glad to see pedestrians and bicyclists have more safety precautions in downtown Portland. Good work.
Thank you, John. Good to see you this morning. And Marina, if you would please take a roll call vote.
Commissioner Myron?
Aye.
Commissioner Jayapal?
Aye.
Commissioner Vega-Peterson?
Aye.
Commissioner Stegman?
Aye.
Chair Kafori?
Aye. The IGA is approved.
Thank you.
R4, approval of intergovernmental agreement with Oregon Department of Transportation for planning, design, and installing safety signage on Cornelius Pass.
So moved.
Second.
Second.
Commissioner Stegman moves. Commissioner Myron seconds. Approval of R4. Good morning, Jessica.
Good morning, Chair Kafori, Commissioners. I'm Jessica Berry. I am the Transportation Planning and Development Manager. The item before you today is a request to approve an intergovernmental agreement with ODOT for planning, design, and installation of safety signage. So this is a grant from the Fed that was awarded to ODOT that we supported the application of back in 2016. So the application went in before the conversation around moving the Cornelius Pass over to the state. So it dates back to before that. We were supportive and continue to be supportive of this because what we're looking to do is put in some signage that will, there will be a vehicle, a variable message board or variable message sign in case there are blockages or weather events up on the road, as well as curve warning signs. There's no financial obligation on our part. We're just working with them to make sure that they are planned and located in a place that makes sense. And that if the road is still a Multnomah County road at the time of their installation, that we would work with them for permitting. So this is just the intergovernmental agreement to participate in this process. Are there any questions for me?
Thanks, Jessica. Marina, did we receive any public testimony on this item?
No, Madam Chair.
All right, well, I'm going to call on commissioners by district to see who has questions or comments, and we will spend time with Commissioner Stegman.
Thank you, Chair. No questions. Thanks for the work, Jessica.
Commissioner Vega Peterson.
No questions. Congratulations on the grant and thanks for all your work.
Commissioner Jayapal.
Thank you, Jessica. No questions.
And Commissioner Myron.
Thank you. No questions, but really appreciate this this partnership, this work, and anything that improves safety on Corn Pass.
I'm in agreement with my fellow commissioner from District 1, Commissioner Myron, and now we will have the board clerk take a roll call vote.
Commissioner Myron?
Aye.
Commissioner Jayapal?
Aye.
Commissioner Vega Peterson?
Aye.
Commissioner Stegman?
Aye.
Chair Kafoury?
Aye. The IGA is approved.
R5, approve East Multnomah County Safe Routes to School Grant Agreement with Oregon Department of Transportation.
So moved.
Second.
I'm sorry, did I get a second?
I
Second.
think you got
I got 4.
2, but I was one of them.
Thank you. Commissioner Stegman moves, Commissioner Jayapal seconds, approval of R5. Welcome back, Jessica.
You. Again, I'm Jessica Berry, Transportation Planning and Development Manager. The item before you today is to approve an intergovernmental agreement with ODOT for a Safe Routes to School grant for East Multnomah County. This grant was awarded to us back in the fall, and we've actually been able to use it since then, but we've been working with ODOT on modifying our scope of work and are now bringing it to you for approval. So this grant is for $300,000 for 3 years, and it funds about half of our Safe Routes to School coordinator position for East Multnomah County. So the activities that happen under this grant are various outreach, education. Right now we're doing some planning work to figure out how to move forward. If the funding doesn't continue, how can we make sure our schools are still doing Safe Routes to School activities? So that kind of activity is happening now. And our Safe Routes to School coordinator is working on helping to install traffic gardens and traffic playgrounds at different locations where young people can interact with a version of our public infrastructure and maybe fall in love with transportation like the rest of us have. That's all I have for you.
I'm laughing with you, not at you.
Thank you.
All right. Now we will, first, Marina, do we have any public testimony on this item?
No, Madam Chair.
Great. Well, I'm going to call on commissioners by district to see who has questions or comments, starting with Commissioner Myron.
And thank you.
Commissioner Jayapal?
It's just such a great program, and it's exciting to get the grant. I don't know exactly what a traffic playground or garden would look like, but I'm looking forward to seeing. Thank you very much.
Jessica, would you tell us what a traffic playground is?
Sure. So in this case, the ones that we will be installing are painted onto a asphalt surface, usually at a school. I think we're actually doing one at another public facility later. But it looks kind of like a road, and it has intersections, and it has kind of like a sidewalk or a bike lane and travel lanes, and it provides an opportunity for young adults or kids to be in an environment and observe and understand how to engage with our roads. So it can be used just for fun, and it can also be used as part of a lesson plan that a teacher or a coordinator might do to help kids learn about traffic or about transportation safety, crossing the road safely, using the lane safely, turn signals, that sort of thing.
That sounds great. Thank you.
Commissioner Vega Peterson.
Thank you, Chair. I think I congratulated you prematurely on the grant, but I'm just very excited about this, because this is a part, it's great that the county can be a part of this in addition to the work that's happening with Metro and the city, and then obviously these state grants. So it's a lot of really good work for kids getting to school and not having to rely on a car. So thanks for all your work, Jessica.
Commissioner Stegman.
Thank you, Chair. As Chair of MUCTEC, the East Multnomah County Transportation Committee, we have always been so grateful to have the Safe Routes Coordinator participate in many of our meetings. I have gone on many walks in our school system with the Safe Routes Coordinator, and it's just a great way to help educate and keep our kids safe. Thank you, Jessica.
Thank you.
Thank you, Jessica, for all of your work. Thank you to the team. And the board clerk will now take a roll call vote.
Commissioner Myron,
Aye.
Commissioner Jayapal,
Aye.
Commissioner Vega Peterson,
Aye.
Commissioner Stegman,
Aye.
Chair Kafori.
Aye. The IGA is approved.
Thank you.
Thanks.
R6, resolution approving the acquisition of certain real property interests for the Northeast 238th Drive Road project.
So moved.
Second.
Commissioner Vega Peterson moves. Commissioner Stegman seconds. Approval of R6.
Hello again, Chair Kafori, Commissioners.
Welcome back.
Thank you. My name is John Henriksen. I'm the Transportation Services Manager in the Transportation Division of the Department of Community Services. Courtney, do you want to introduce yourself?
I'm Courtney Lords with the County Attorney's Office.
For this item, I'm requesting board approval of a resolution allowing for the purchase of property interests required to construct a project on Northeast 238th Drive in East Multnomah County. The project will improve a portion of Northeast 238th Drive between Northeast Halsey and Northeast Gleason, and is partially in the city of Wood Village and partially in the city of Troutdale. The project will widen existing vehicle lanes to improve freight transit and safety through this area, add 10-foot raised multi-use paths for bicycle and pedestrian traffic, and will resolve existing drainage issues. The multi-use paths will be separated from the roadway traffic by water quality facilities or landscape strips on either side of the road. Construction of this project is expected to begin in the spring of 2021 with completion in late fall. The total project cost is estimated at $8.4 million. The Transportation Division has secured $7.5 million in funding from outside sources for the project, and the remaining project expenses will be covered by the County Road Fund. Acquisitions consist of a road purpose, slope, and temporary construction easement from a multi-family condominium property, a sidewalk easement from a privately owned mini mall business, and a road purpose easement from the Reynolds School District. The total cost of the easements is $402,800. The settlement with the Reynolds School District included a commitment for the county staff to bring to the board a proposal to vacate unused portions of Northeast 238th and Northeast 242nd connector roads at dead end on the remaining Reynolds School District property. First presentation of the proposed vacation will be brought to the board at the August 6th meeting. With that, Courtney, do you have anything to add?
I do. So as you know, we have briefed each of you individually, and as a body, you have approved authority for the County Attorney's Office to proceed with condemnation on 3 of the properties impacted by this project. What you are doing today is the formality under our internal administrative policy, TRS-01, which is you are formally authorizing the 3 settlements that we have reached in those condemnation actions. Unless there are any questions related to that, I don't have anything else related to the condemnation.
And pursuant to TRS-01, the project has been planned and located in a manner that is most compatible with the greatest public good and that will cause the least private injury. All notices and negotiations complied with federal and state laws. That's all I have on this item. Are there any questions?
Thanks, John, and thanks, Courtney. Marina, did we receive any public testimony on this item?
No, Madam Chair.
All right, well, we will go through the list of commissioners to see who has a question or a comment, and we'll start with Commissioner Stegman.
Thank you, Chair. I want to thank Courtney and John. There was a lot of behind the scenes negotiations, and this process could have been drawn out much longer and at a higher cost, but because of their hard work, that did not happen. So I just want to acknowledge everything that you put into this, Courtney. I appreciate the Reynolds School Board working with us, and I think we landed on a solution that benefits both parties, and most importantly, makes that, if anybody has drove on 238, you know what a terrible road that is, and especially in the winter. So I'm really grateful that we're going to make this road safer for everyone. Thank you.
Commissioner Vega Peterson.
No question. Just want to thank John and Courtney for all their work. It sounds like you guys did a great job in getting this to work for Multnomah County. So thank you.
Commissioner Jayapal.
Thank you for all your work, John and Courtney. No questions.
Commissioner Myron.
Thank you. No questions.
Wonderful. I just want to thank everyone as well. I know that this has been a long time, and as Commissioner Stegman said, there was a lot of conversations and a lot of chance for disagreement. So I want to thank everyone who worked so hard to get this finished. And now the board clerk will take a roll call vote.
Commissioner Myron,
Aye.
Commissioner Jayapal,
Aye.
Commissioner Vega Peterson,
Aye.
Commissioner Stegman,
Aye.
Chair Kafoury.
Aye, the resolution is adopted.
Thank you.
Thank you.
R7, proclaiming July 26, 2020 as Americans with Disabilities Act Awareness Day in Multnomah County, Oregon.
So moved.
Second.
Commissioner Vega Peterson moves. Commissioner Stegman seconds approval of R7. 30 years ago, on July 26, 1990, to be exact, President George H.W. Bush signed the Americans with Disabilities Act into law. Like all civil rights laws, the ADA, as most Americans now call it, was the hard-won result of a social justice movement led by activists and organizers across the country, including in Multnomah County. Disability rights activists were influenced by the strategies of the civil rights movement, holding sit-ins at federal buildings, obstructing traffic to protest inaccessible buses, and marching to protest discrimination. The legal road to pass an ADA was a long and winding one, beginning with the Rehabilitation Act of 1973, the passing of special education laws in 1974, the addition of disability as a protected class to federal fair housing laws in 1988, and culminating with the ADA, which Congress passed in 1990, ensuring the civil rights of Americans with disabilities. The ADA is one of the most consequential and transformative pieces of legislation in this country's history, making sure that the millions of Americans who live with a disability can thrive and participate fully in the workplace, in public, and at home. And here at Multnomah County, we work every day to honor and live out the values of inclusion, quality, and accessibility that are at the heart of the ADA. And that's what we're celebrating today. Now I'm going to turn it over to Commissioner Myron, who is sponsoring this proclamation.
Thank you, Chair. I am so pleased to join you in sponsoring this proclamation in support and celebration of 30 years of the Americans with Disabilities Act. I mean, I just can't even imagine that the time before this. I have been honored to serve as the board's liaison to the county's Disability Services Advisory Committee, or DSAC, since 2019. The DSAC advises the county's Disability Services Office about policy guidelines, advocates for issues that are pertinent to the life and welfare of people with disabilities in Multnomah County, and educates the general public about issues and concerns facing all people with disabilities living and working in Multnomah County. I wanted to share some information about Multnomah County's role advancing the rights of people with disabilities. The county is the lead service provider for people with disabilities, including innovative service delivery and systems improvement programs. For example, The Department of County Human Services, DCHS, Aging, Disability, and Veterans Services, ADVSD, offers a program called Employed Persons with Disabilities that allows consumers to work and continue to receive Medicaid benefits. This program currently has 471 participants. The Intellectual and Developmental Disability Division of DCHS provides housing, support services for stabilization of family and clients yearly. In 2020, over 1,000 different housing support services were provided. 97% of clients on average maintain housing for at least 12 months after receiving housing support through IDDSD. And finally, the Domestic and Sexual Violence Coordination Office within the Youth and Family Services Division of DCHS convenes a grant-funded collaborative called McNeff's Open Doors for Survivors with Disabilities, bringing domestic violence and disability fields together to learn from one another and improve the systems of services for survivors experiencing abuse with disabilities. These county programs work hand in hand with the ADA, and I am so thrilled to be able to support this proclamation today. Now, I am pleased to introduce Ashley Carroll and Don Martin.
Good morning.
Good morning, Chair and Commissioners. My name is Ashley Carroll. I use she, her pronouns. 3 years ago in August, I attended a focus group hosted by the Office of Diversity and Equity and the Evaluation and Research Unit in partnership with what was then known as ADAPT, the Employee Resource Group for Employees with Disabilities. That spring, I'd taken a leave of absence to go to rehab and shared my experience through that process and subsequent return, as well as the accommodations I'd requested and needed to do my job. In April of 2019, I sat before this board and presented the findings of the research on equity and accommodations for employees with disabilities, the outcome of that focus group, which later became part of the county's Workforce Equity Strategic Plan and resulted in a new position in the Civil Rights Policy Unit of the Office of Diversity and Equity. In February 2020, I began in that role as the Disability Resource Specialist in ODE. This position focuses on the internal employee accommodation process and larger disability equity efforts. In the time since I've started, I've begun working with employees and human resources on reasonable accommodation issues, created a work group related to ADA that will likely become a community of practice, and helped create and staff a disability access advisor position in the Emergency Operations Center responding to the COVID-19 pandemic. There is so much room for improvement in the way employees with disabilities experience their time at Multnomah County, especially employees of color with disabilities for whom the reasonable accommodation process can be fraught with additional systemic barriers. Your investment in this work makes a difference, and for that, I am so grateful for the opportunity to do and coordinate countywide change. With that, I will hand it over to Don Martin, an IDEA leader, to offer additional remarks and read the proclamation.
Thank you, Ashley. Good morning, Don.
Oh yeah, Dawn has no sound. I'm supposed to text her. She can't hear us. Sorry.
Ashley, can you hear me? Ashley, can you hear me? How come I can't unmute myself? You can hear me?
Yes. No.
I have been on the telephone with two of our fabulous Multnomah County tech guys for 20 minutes, and I still don't have any sound, so I'm a little rattled. My name is Dawn Martin, and I work with Central Purchasing, and I'm part of ADIS leadership team. This proclamation was supposed to be one of many activities to celebrate this act, turn the world and the way the county does business upside down. This has brought both challenges and opportunities. In-person events needed to be canceled, but it turned out in the midst of all this difficulty, there have been some unexpected positives. The ADA provides many rights and supports employees in the workplace. One example of this is requiring employers to provide reasonable accommodations. For many employees with disabilities, working through the ADA reasonable accommodation process to allow them to do their jobs and simultaneously feel well has had some challenges. Private offices are few and far between and generally reserved for management. Teleworking, although granted as an accommodation, is generally limited to 1 or 2 days per week. Whether or not this accommodation is granted depends entirely on the supervisor and whether or not they perceive essential job functions can be completed from home versus in reality. A coworker was on FMLA for several months because the county insisted her job could not be done from home. Apparently, during this pandemic, her job can be done from home. The only thing that kept her from working was management. This pandemic gave her her job back. It's also given many employees with disabilities their health back. In light of Governor Brown's phasing out of the state's stay-at-home orders, the Office of Diversity and Equity reached out to employee resource groups for feedback on their concerns and needs around transitioning out of the stay-at-home orders. Employees were also asked to identify unexpected positive changes to their work life that they might want to continue. And I wanted to share a few of these responses with you. And I'm eating better, I'm sleeping better, my chronic body pain has lessened. I'm able to do my physical therapy exercises on my breaks, and I can focus and be more effective at my job. I can do my job just fine, and I think I've been a better employee since the quarantine started. Another coworker says, telework has been so good for my mental health. Somebody else says, my productivity is greatly increased when I can control scents, temperature, sound, and distractions in my environment. Another IDEA member says, I often have migraines, so it's really nice to be able to lay down on my lunch break if not feeling well, or close the blinds so that I can work in the dark room when my head is hurting. And finally, somebody says, I would like to primarily work from home. I have access to modify my needs without going through so many levels of approval when what I need is immediate, such as adjusting lighting, stepping away to take prescriptions, and self-care without stigma or peer questioning. IDEA is fond of saying, don't plan about us without us. Please take the lessons learned from this pandemic and employees with disabilities' needs and experiences into consideration, not only when the county reopens, but for years to come when determining whether or not an employee can reasonably work from home as an accommodation. Do I go right into reading the proclamation?
Yes, please.
For proclaiming July 26, 2020 as Americans with Disabilities Act Awareness Day in Multnomah County, Oregon. Approximately 61 million people in the United States have some sort of disability. This represents our nation's largest, most inclusive, and most diverse minority group. All ages, genders, religions, ethnicities, sexual orientations, and socioeconomic levels are represented. Disability is a natural part of human experience. People with disabilities are people first who happen to have a disability. The Americans with Disabilities Act was passed on July 26, 1990, to ensure the civil rights of citizens with disabilities. On the 30th anniversary of the ADA, we celebrate this historic legislation, which reflects our nation's dedication to securing the equal rights and defending the intrinsic dignity of all people. Today, we renew our commitment to empowering Americans with disabilities through equal access so they can achieve their full potential, and we celebrate their contributions. Since 1990, the ADA has transformed the lives of millions of Americans by promoting equal access to employment, government services, public accommodations, commercial facilities, and public transportation. The millions of people living with disabilities are part of the fabric of our nation, and the ADA helps eliminate barriers to their full participation in every community across the country. We are grateful for the ADA for helping to foster a vibrant culture of inclusivity. Multnomah County of Oregon affirms the principles of equality and inclusion for persons with disabilities as set forth for the state of Oregon and as embodied in the ADA, the laws of the state of Oregon, and ordinances of Multnomah County. Sorry. Numerous organizations in Multnomah County and Oregon work with constituents and communities to bring forth the promise of hope and freedom that is envisioned by the passage of the ADA. As we commemorate the anniversary of the ADA, we recommit to working together to ensure people with disabilities have every opportunity to succeed through equity and accessibility. The Multnomah County Board of Commissioners proclaims July 26th as the 30th anniversary of the Americans with Disabilities Act Awareness Day. We celebrate and recognize the significant contributions of people with disabilities to the workforce and to the community. We extend greetings and best wishes to all observing July 26, 2020 as Americans with Disabilities Act Awareness Day. Thank you. And I can't hear anybody. I still have no sound. Thank you.
Well, we will thank you anyway, Dawn, and thank you to Ashley. And I'm going to call on commissioners by district to see if anyone has a question or a closing comments. We're going to start with Commissioner Stegman.
Thank you, Chair. Thank you to Commissioner Myron for bringing this proclamation forward. And in these times, we know how important it is to stand up and fight for our rights. And I'm glad to hear that Ashley has been able to bring her lived experience to her disability resource specialist position. And Dawn, I love what you said about all the quotes about folks that, yes, actually they can perform their jobs at home and actually be more productive. So there is some silver lining that this pandemic has brought, and I'm glad to see that folks are able to do their jobs in a healthier way and also be more productive. So thank you everyone for bringing this forward.
Commissioner Becky Peterson.
Thank you, Chair. Thank you, Dawn and Ashley, for sharing this presentation today, and thank you, Commissioner Myron and Chair, for sponsoring this proclamation. It's really, this is one of those things where we're celebrating the 30th anniversary of the ADA, and just like with other civil rights legislation, we still have a ways to go to make sure that this is the ideals that are in it and the legislation that's in it is actually a reality that people can experience. So I just appreciate the work that you're doing as part of the work that so many here at Multnomah County are doing to make sure that, for our employees, that this is a reality and they have accommodations and they have an environment where they can work and really work to their best selves. And I do agree that, the COVID situation and working from home has really shown, I think, in a lot of ways, how much more flexible we can be. And I think that's something among like many of the things that we're going to take away with us as this has gone, that we need to really make sure that we're being flexible and accommodating to the work situation that people's need. So I really appreciate you mentioning that today. Thanks so much.
Thank you. Commissioner Jayapal.
Thank you, Chair, and thank you, Chair, and Commissioner Myron, for bringing this forward and giving us a chance to celebrate not only this incredibly important piece of civil rights legislation, but also all people, and in particular our employees who experience disabilities. Thank you, Ashley and Dawn, for being here. Thank you to DSAC for all the work that you do all year round. And thinking about our employees who not only serve our community every day, but also are helping Multnomah County as an employer and as a county at large continue to make progress in terms of accessibility. I'm really struck by, Dawn, by the quotes that you read and by what you shared with us about the accommodations that we have made. And, as my colleagues have said, amidst the tragedy of COVID, there's also this chance to not just shift practice in small ways, but to have a paradigm shift. And I'm struck by the fact that the baseline used to be, we assume you work from a workplace and you need to show us that you can do it differently from home. I think what we're seeing is that we can shift that. We can say, why not presume that you actually are able to work in other ways? Why not presume that the accommodations can work? And then to the extent that there are places that we need to adjust for that, then we do that. So again, thank you to both of you for all your work. Thank you for being here. Really appreciate it.
Commissioner Myron.
Thank you so much to Ashley and to Dawn for their presentation here today and sharing their own experiences. Ashley, you've been such a tremendous inspiration and resource, and I was and continue to be so pleased to learn of your new role at the county. A lot of what you described, a lot of what has been talked about kind of reminds me, I attended an AARP forum on aging back when we could attend things in person some time ago. But there's a founder of a concept who spoke, and it's called 880 Cities, and it really stuck with me. And it's the idea that right now we sort of build our cities, our infrastructure around the needs of, healthy, fully abled 30-year-olds. But wouldn't it be an amazing thing if we actually built our cities and had that infrastructure and support to accommodate our residents from 8 months, 8 years to 80 years of age and beyond? We need to make our cities and communities and workplaces and everything else accessible and inclusive for everyone. I remember attending when I attended an IDEA meeting, again, back when we could meet and see people in person, whenever that was. But it's such a a really incredible group. And what's interesting and what really struck me, Dawn, when you were raising your comments that my fellow commissioners have spoken to as well. People expressed the needs for accommodations that, they had to just stumble through this bureaucracy and take all these steps to achieve for the most basic kinds of support for what they needed to thrive in doing the work that they do. And the lessons that we are learning and some of the positives that we can take from the experience with COVID, that there are things that we can do. We can break down those barriers. We can have accommodations if people are supported in working from home. And so I fully expect that we will take these lessons to heart and that we will be able to incorporate them into the work that we do as a county to support our employees moving forward. But thank you both. Thank you to the IDEA group, and thank you to everyone who has worked on this. And just thrilled that we're going to be celebrating this today. That's it.
Thank you, Commissioner Myron. Thank you to all the commissioners. And thank you to Ashley and Dawn for being here today. And Dawn, even though you can't hear us, we could hear you just fine. So hopefully you'll have a chance to listen to this after we're finished. And I'm just really thankful that the IDEA ERG ensures that the spirit of the ADA is honored every day at Multnomah County. And something that really that strikes me is that at the heart of the disability rights movement and the ADA was a fight that was just as much against systemic discrimination as it was a fight to be seen, honored, treated, and valued as whole people. And here at Multnomah County, our values of safety, trust, and belonging dovetail so beautifully with that. I know that we have a lot to do to improve. There's always improvements that can be made, but I have hope that we can work to be a workplace where employees with disabilities feel supported and empowered to be and bring their self to work each day. So thank you to everyone. And Marina, would you please take a roll call vote?
Yes, Commissioner Myron?
Aye.
Commissioner Jayapal?
Aye.
Commissioner Vega Peterson?
Aye.
Commissioner Stegman?
Aye.
Chair Kafori?
Aye. The proclamation is adopted, and this is our party that we're going to have right now. Woo! Yay! Thanks, everyone.
R8, informational board briefing on COVID-19 response.
Marina, do you want to get the slide going? And I think Rachel Banks, our public health director, is kicking it off, if I am not mistaken.
Good morning, Chair Kafori, commissioners. For the record, my name is Rachel Banks. I'm your public health director, and I use she, her, and her pronouns. I'm happy to be with you all this morning and happy to follow such a fabulous proclamation. I'm joined today with our Deputy Public Health Director, Jessica Banks, our Emergency Management Director, Chris Voss, and Kim Taves, the Communicable Disease Director. And we are, next slide, please, Marina, going to be doing our usual updating for you all of where we are in the fight of the COVID-19 pandemic. We're going to be sharing updates on our data and metrics and talking about the local role of the local public health authority in schools reopening planning. So with that, I am happy to turn it over to fabulous Kim Taves.
Thank you, everyone. Marina, if you could go to slide 5. I know that's a little bit out of order, but we're going to work backwards here. This is the slide of hospitalizations, and I'll talk about the case data and the hospitalization data first. So what we see here with the hospitalizations is that we have some increases in the last few weeks, but the one that's marked 12 July, just to remind everyone, what that means is the week of the 12th to the 19th. So that's not just one day, that's a whole week. And we see that it decreased a little bit, which is great because our case numbers overall have actually been going up. So I want to talk a little bit about the case numbers in a different way, which is to explain something people may have heard called the R naught or the R effective number. And what that means is R naught is R with a little 0 after it. And that describes in an equation that we use to talk about how a virus or a bacteria moves through a population. It's called the reproductive number. And so what that means is for every one infected person, how many people do they spread that disease to? And that's how you can see if the epidemic is going to expand exponentially, or if it's sort of going to stay steady state, or if it's going to die out. If one person ends up passing the disease on average to fewer than 1 people each, then you can see naturally that the numbers slowly decrease because the virus just isn't able to get into enough new uninfected folks. As we have more immunity, if we do actually develop immunity to this in the community, then when the virus comes in contact with various people, it won't actually be able to infect them. And we would expect the number to decrease below 1 and the epidemic will die out over time. Also, if people wear something preventative like a face covering or a mask so that the virus can't get into them, and they wash their hands so that they're not bringing the virus into their own mouth or nose, then it also will start to die out over time. What we've seen with the R number for our actual spread of disease, which has to do with how infectious it is, how much or how little people prevent it from getting into their body, how many people someone is in contact with while they're infectious, staying at home versus being in a busy, close workplace, for example, all of those affect that number. So what we have since mid-May is it seems like we have a R number that's about 1.5. And so what that means is for every 1 person who gets infected, on average, they infect another 1.5 people. And as you imagine over time, then you end up with case numbers increasing. So what that looks like, if we don't reduce it, is that our epidemic will continue to accelerate. Some extrapolations we've done with the data based on testing and historic data suggest that right now, how much disease there actually is in our population. And you know, that's folks who haven't gotten tested that we don't know about. It's like the part of the iceberg that's underwater. Is probably the highest that it's ever been. So even though some of our hospitalization numbers are lower than they were in March and April, if you look at this slide, the total number of people who are infected right now, from what we can tell, even with relatively limited testing, we're going to make our best guess of how much of that iceberg is below the water, suggests that right now we probably have the highest disease prevalence in Oregon that we've had yet in the epidemic. Our cases themselves increased 33% from last week. Even though the hospitalizations went up the previous week and are down a little bit this week. The hospitalizations are the people who are really sick, and we know we can't prevent all cases, and our ultimate goal is indeed to try to prevent people from getting severely ill or to help them heal quickly and thoroughly if they do. So just to give you a sense of the numbers, in the last 3 weeks, our total case count has been 351, and then 402, and then 607. So that's where we're at. Emerging populations, I will say predominantly still we're having a large focus of this infection among Latinx folks in our community. We also do see overall elevated rates among Pacific Islanders. The highest rate of positivity for testing, which means for the number of people being tested, which group has the highest number that actually come back positive, is among adolescents and young adults, which would be 10 to 19-year-olds. And that includes Latinx, Black, and white folks. But the total number of people tested for young adults and for adolescents is only a quarter that of the testing for adults. That may in part be because they tend to not be as symptomatic, and so they may not seek testing as much. We also, and I'll talk a little bit about testing challenges in a minute, but we also do still not have a huge expanded access to testing in our county or in our state. The rate of the disease at the population level is highest right now among the 20-year-old age group. But that may look like that statistically because that group is actually having a pretty high rate of testing. So that's where we would be finding cases, right, is among who we test for it. Let me ask you to go on to the previous slide, which is slide 4, Marina, if you could. And I'm going to talk a little bit about the test data. So testing right now, you may have heard through the news from various reports that we have put out and briefings that we've done with the media. Some testing facilities are having some challenges nationally, and that is impacting us locally as well. So you'll see a little bit of a drop in the past week in testing. There was an increased capacity, increased people seeking testing, as well as increased lab capacity for doing the tests. But right now, we're having some challenges nationally with enough laboratory chemicals, the reagents for the test kits. There's also cartridge devices for the rapid test kits that have been in short supply. So the various hospital labs and commercial labs have been trying to use a variety of different supplies from different folks, different commercial agents that produce those supplies to piece together enough supplies to do the testing. Because there's a few different kinds of testing that doesn't impact each test site or each health system the same way. Some are going to have more capacity one week based on the particular product they use, and others in other weeks. For right now in Multnomah County, for our own clinical services that we provide testing, we've had a really long lag time with our lab provider where it's taking upwards of 11 to 14 days to get test results. That's challenging because at that point, people can't take action on that information. They're basically already out of their quarantine period and probably have already transmitted it to anyone they were going to transmit it to by the time they and we get the test result. For Multnomah County specifically, we're bringing in some other laboratory options right now to try to switch over to a different lab. But that is something that we've had ups and downs with lab capacity across the country and across the state since the very beginning of the epidemic. And unfortunately, that will probably continue to have times where we have great capacity and times that we have limited capacity. I know that right now in Multnomah County, the most low barrier testing is provided by OHSU at the Expo Center through the drive-through testing, and the wait times are quite long right now, and a number of folks are being turned away. And that's at a time where a lot of folks are seeking testing because businesses are requesting that if they've been sick, they get a test to come back to work. The CDC just updated their guidance in the last 2 days to make really clear that a negative test is not actually the way to clear someone to come back to work. It's really based on the number of days after they started to have symptoms or after they had a positive test. So a healthcare provider would be able to talk with someone and let them know when they would be cleared to come back to work. And a negative test isn't actually the guidance. But a lot of businesses are requesting that, and that's putting a lot of pressure on employees to try to figure out where they're going to get tested. Most of our test sites still have the capacity only to test people who have symptoms and not just to test the general public. So what we'll see for the race and ethnicity among tested individuals is we're holding steady. We had an increase, which is really important, and we're holding steady and not continuing that much in the last week to increase the proportion of folks who are people of color getting tested. We certainly see in our own East County test site that we're predominantly testing people of color, and we have a high positivity rate. We are testing symptomatic people only. So I know we're testing the right people that need to be tested when we do that. But we're all, as a healthcare system, continuing with the state and local health departments, as well as some of our hospital partners, to try to stand up more community-based testing that's culturally specific and some other more low barrier options. If you'll go on to slide 6, then that I will give you some information about outbreaks.
Can we pause here, Kim? And
sure. Yes.
Because now we're moving away from the testing to discuss. Okay, great. So We're going to pause for a moment and have questions on testing. We're going to start with Commissioner Myron.
Thank you, Chair. Thank you, Kim. A couple, just, I, as are you, I know it just continue to be frustrated by the testing situation in general, which I know is, nationally such an issue. And I still don't get how, 6 months or however many months we are into this is such a national problem when other countries have seemed to manage to do this right. But I have a question. Just how many tests do we do really from the county on average? Like, what is the number that we do? Is that on here? I just don't know.
That's sorry. Computer wants to mute me. That's not on this graph. I can tell you that we're probably doing, I'm going to guess for primary care. I would have to look it up. I'm going to guess we're maybe doing 50 tests a week, and I can confirm that. We've had an increase in testing demand at our East County community drive-through test site. So we're testing usually on the order of 80 or more people per day, and it's open twice a week. Our positivity is usually around 30%, which is really high if you look at the positivity on average for tests that's done. I will say, though, that orange line on the race and ethnicity among tested individuals graph that you see up right now, the orange line represents of the total number of tests, how many are positive. And you'll see that it does continue to increase. Our positivity is higher because we're testing symptomatic folks. That orange line represents all the tests done in the whole county. And so that does include people who are employees who are just getting screened to make sure they're negative if they're healthcare workers, people who are being tested because they're about to have surgery, so they're not necessarily at risk. We have done a few different community-based testing events where we have tested 60 to 280 people. This week, we don't have one of those happening. We are staffing up so that we can also open a mid-county drive-through test site as well. I think that OHSU right now is testing a good few hundred people a day at their expo center. I think their Hillsborough center is less busy.
So I just have a question. So in terms of it, so it sounds like for Multnomah County, for our sites, we're doing about 200-ish tests a week with an average 11-day to 14-day turnaround. What is there? And that seems like there is a lot of, energy, resource, time, et cetera, put into doing that. What is that telling us? I mean, like you had mentioned, by the time, if it takes 2 weeks for turnaround, and really, if people are symptomatic, we're treating clinically regardless. They'll have missed the quarantine. We'll have huge issues in terms of contact tracing, et cetera. It's not enough to be I don't know if it's statistically significant or not, but what is this getting us?
Well, 11 to 14-day turnaround time doesn't get us a lot of anything, frankly. The lab we use moved from priority 3 having 11 to 14-day turnaround time to, in the last few days, now priority 2 tests also have an 11-day turnaround. So what we have done is we worked really hard over the last 12 to 13 days to be able to transfer to a different lab that we are using this week, starting this week at our own drive-through test site. And so I imagine that the testing that we do today will actually have a 24-hour turnaround time. So when, the turnaround time all of a sudden got very long, and it took us a good week to sort out the clinical workflows. Luckily, we had a contract in process that we had executed a number of weeks ago, expecting that we probably needed to have more than one different lab option in case that happened. So we have implemented that this week for our own testing.
Well, that's great. And hopefully that'll be helpful. But But still from that, I don't.
Do you have other questions or comments, Commissioner? I know other people have questions as well, so I want to allow it.
Sorry, it was hard for me to formulate the question because there's so much there. So go ahead to other people. That's fine.
Yeah, we can come back to you, but Commissioner Jayapal?
Thank you. Yeah, just a couple of additional questions, Kim. You mentioned priority levels that labs have. Is that a standardized set of priority levels? And what are those priority levels? What are the criteria?
Yeah, the priority levels are set by the federal government as recommendations for the labs to use. The state lab, for example, doesn't have priority levels, but it is not a commercial lab. It's using its lab resources, for example, to test primarily at outbreak sites, long-term care facilities, and the like throughout the state. Some of the commercial labs are using the priority levels. It's a combination of people who are symptomatic and very sick, hospitalized, being top priority, as well as people who are symptomatic, who work as essential workers in healthcare systems and other critical systems. So it's based on the severity of illness, as well as based on if you're someone who's critical to find out if you're sick, either so that the essential workforce continues and or so that people working in that essential workforce don't expose other staff or patients. There's 4 levels. And the 4th level is not priority, which all asymptomatic folks are in. The top 3 levels, you have to have symptoms to be prioritized at all for that lab. Yeah.
So I guess I'm a little puzzled by severity of illness being a priority, because as I've understood it, testing isn't for treatment purposes, it's for public health and tracing purposes. Right. So why would severity of illness be the top priority?
You are asking a really good question. And I was just looking yesterday at the CDC guidelines for prioritizing case investigation, and as well the severity of symptoms is on there for prioritization for case investigation as well. And I need to do a little bit more research on what the driver for that may be. That wasn't clear to us either doing the case investigation work, why, that doesn't affect why, the reason for doing case investigation is if you're infectious at all, we need to help you stay home and to help other people not be in contact with you, to help them stay home if they may have been infected by you already. It doesn't really have to do with your own personal experience of how severely ill you get. Yeah. Good question.
Another question. Thank you. Another question about kind of low barrier testing and who's providing it. We're providing it. OHSU is providing it. I saw that they're also doing sort of a community pop-up event this week on the West Side, which is, BIPOC focused, whether symptomatic or not. Are there levers available to us or to the state to have more of the systems providing low barrier testing? So it's not just the county and OHSU.
I think that's got to be a question for the Providence, Legacy, Kaiser medical leadership of those health systems about if and when and how they feel like they've got the capacity to take on some of that low barrier public access testing that's not just for their already registered patients.
And then one last question. In terms of, we were having trouble with the lag time on the previous provider. We switched to a different provider. Is it, I know you don't have a crystal ball, but is it likely to be this sort of hopscotch that we have to do in order to get testing quickly, that it just depends on who we've got a contract with, and if they're not able to deliver, we've got to look around? Is there not some sort of systematic, some sort of evening out of resources, some way to make this more organized or more systematic?
Well, the problem is national. So I guess what you're asking for is a national policy that's cohesive around actively promoting industry and hospital systems and health departments to support testing in a way that has not happened at any time, actually, during the whole duration of the pandemic. To speak frankly, the federal government had supported directly testing and also supported funding for testing in a number of areas. They closed down a lot of the places in different states where they were standing up testing because the state themselves didn't have the capacity. A lot of the reasons that the states and the local health departments didn't have the capacity to stand up their own testing is that honestly, public health funding at the federal level has really been gutted. And at some state levels too over the years. So, the public health system was not the most robust when we started out this pandemic due to years and years of budget cuts. But I think there's a combination that we don't actually have a system of healthcare or a system of medicine like a lot of other countries do that's more socialized. It's very piecemeal. So there's less that the government can do to support that. But we also have had a federal leadership that's not promoting a cohesive, aggressive approach to testing access.
Yeah, absolutely. Sorry to make you describe what's become obvious, but thank you.
Yep.
Commissioner Vega-Peterson?
Thank you, Chair. Thanks, Kim, for that. I mean, that was really the same lines I was thinking. I mean, I know my dad is going in for a medical procedure this week, and he's going to get tested and results back right away because that's what's required for any surgeries and there's capacity to do that there. But then there's such a big difference in other testing capacities, and there hasn't been any kind of national push to really make sure that the resources are there for everyone to get a timely response, and it's such a shame. My question is a little bit more specific, though, to Multnomah County, and it really has to do with the slide we're looking at here, where we're looking at, who's getting tested, and then, slide 3, where we're looking at who is actually has COVID in Multnomah County. And I know we've put a lot of effort here to making sure that BIPOC access to testing is something that we're prioritizing, but it's still concerning that we have, more cases in BIPOC community than not. And so are there other things that we can be or should be doing to really make sure that the communities being impacted the most are getting access to testing?
Well, we're going through a hiring process right now to get a full set of testing staff that are dedicated to just doing community-based COVID testing. And so I think once, over the next couple of weeks when we fill those positions for nurses and medical assistants, which, county hiring just takes a good few weeks to have that process go through. But when we do, I think, we'll be able to open up mid-county testing as well. We also have a very diverse set of community health workers that just started training last week from our funded community-based organizations. I think they'll be able to do a lot of the work to help educate folks about what the test means and what kind of services are available if someone does test positive. I think there's a whole lot of folks who are afraid to get tested. And so we're really going to rely on our community health workers that are known and trusted in communities to help encourage folks to come out and get tested. And then meanwhile, we'll be working on standing up more testing access and capacity. The state has some funding and some dedicated effort to put in with community-based organizations as well to do some more of that pop-up, stand-up testing. I think that is really helpful to help people feel comfortable with testing and have a first testing experience that feels safe and okay and culturally familiar to them when a community-based organization hosts it and the state or we come in and provide the actual testing itself. I think what we'll need is we need a larger availability of testing that is just frequently and regularly available a number of days a week. So that's what we're working towards is not that kind of like ad hoc pop-up model. We still will need to have a whole team, which is in our strategic plan as well, that can be much more responsive to go into like a particular hotspot, whether we're working with an employer, and we have done this before already, is if we work with an employer and we would really love it if they would organize testing for their employees and pay for that testing. But if it's not going to happen, ultimately, the most important thing is for us to get employees of high risk settings tested. So we've been able to help facilitate that as well as do some real localized hotspot testing in apartment buildings or the like. So I think we'll be able to increase that as well. And we hope in that way to be a little bit more like rapidly responsive to really super focusing our resources. when we've done some of that community testing, that is really, although it's BIPOC focused, it's people who don't have symptoms and also aren't contacts. We, sorry, my lights are off. We actually have had a really low positivity. And so that approach is not it's very resource intensive, and that approach actually hasn't had a lot of public health impact. It's been more helpful if we have focused testing resources towards folks who have symptoms and or we know our contacts, either their healthcare provider knows that they're a contact or our public health staff do, and they refer them into testing. So it's a learning process. We may have ideas a few weeks from now about new and different models that are less resource intensive and that we can disseminate more. We're sort of learning as we go about the right way to test.
Okay, thank you, Kim. And I appreciate that there's a lot of things that are still, in the works in the plan, but it just takes time to set up some of these things. But I appreciate that the direction that we're going in and the efforts that you're putting into really addressing the need in the community.
Thanks.
Commissioner Stegman?
Thank you, Chair. Thank you, Kim. Kim, what authority, I'm trying to understand the hierarchy of like the Oregon Health Authority and how do they interact with our local hospitals around, what testing capacity do our local hospitals have? What authority does the OHA have? I mean, I'm thinking in terms of like the Defense Production Act, where we saw, wineries and breweries who are now making hand sanitizer. But it sounds like we're headed for, a shortfall in testing facilities. And so my question is like, how do we ramp up, given what you just said, that there is no federal coordinated response and the states are left to their own devices? And if that's the case, which we know it is, then I feel like we need to be standing up, whatever we need to stand up here in Oregon. I'm just wondering, what does it look like and how would we go about that?
Rachel.
Why don't Rachel?
You want to take that one, or Dr. Vaughn?
This also might be a longer conversation. It's a good question. It's just a really, there's a lot there. So, and we have, Rachel, do you just want to give not that there is a brief answer, but maybe we can talk with Commissioner Stegman afterwards too.
Yeah, I think it's a great question. It's a hard question, and I'm happy to follow up in terms of what sort of authority that the state has. I would hate to ill speak of what that authority is, but I think to Kim's point earlier, we have a health system and we have multiple players in that health system, and so we're, your conversation is bringing up multiple regulatory authorities in the public health and the health system realm. And I wish there was a better answer in terms of us having a coordinated national and approach to testing, but there are a lot of complexities in that. So I can commit to following up with Oregon Health Authority and getting back and having a more hopefully more satisfying, but if not more satisfying, at least a more clarifying answer for you.
Yeah, thank you. If we could have another, maybe the next briefing, if you could report back to us, that would be great. On the East County facility, it was mentioned that there's about 80 tests per day. What is the capacity of that location?
We've really just hit the capacity in the last couple days. Up until then, we have not had as much demand as we have availability to test. And in part, I think that's because of word of mouth. In part, that's because there are some concerns that folks have to hesitate as well. But I think as it becomes known, the demand will increase. So our capacity is about 100. With our new different lab we have, is a little bit of different workflows. So we'll see this week if our capacity still remains at 100 or if it dips down a little bit while our staff get used to using those workflows. But that's about where we're at.
Great. And this question maybe in the next briefing we could address, but one of the things when I visited that test site is, and thank you all, I think Rachel sent me information about the different priority levels. But my question is that not everybody that comes to the East County site, and I believe that we were like a level 3 priority. I mean, there are different people that have different symptoms that may bump them up into a priority 1. So I just kind of was not understanding, like, why are we dictated by a geographic site as to what level of testing response quickness we would get, because we have such a diverse population. So if maybe somebody could address that in a future briefing, that would be great.
I can give a sentence right now, which is that we're actually not dedicated. We're not limited to have one priority level for all people testing at one facility.
Okay.
That's to be assessed individually. And then there's a card that gets filled out per individual lab. However, in the last week, the priority 2 folks, who are those higher level priority, not hospitalized, but higher level folks that we would test, priority 2 for our commercial labs started to also take 11 days. That's how overwhelmed they are. So that's why that was our first option. And then our second option was just to move directly to using a different lab for right now.
All right. Thank you so much, Kim.
Yep. I just have one more couple set of slides on outbreaks, and I'll just go through really briefly because I know we took a lot of time on that, and there's other folks who want to share some other information.
And
thank you.
I did reformulate my quick questions on testing.
Okay, if it's quick, please. We've got a lot more to cover.
I know. So you'd mentioned just hiring people to do, and I can just raise the questions and then we can get answers back maybe outside of the briefing would be fine as well. But
thank you. If
we could get an answer, like you'd mentioned hiring up to be able to do the testing, and I'm wondering if we, our efforts have been made to deploy or redeploy our health department or other employees to do that work. Is one question. And
yeah, we can answer that question. Yes. That's what we've been working on that for a long time. So that's a yes.
Okay. Awesome. And just question about how engaging with the leadership of Providence, Kaiser, and Legacy that Kim mentioned that could help address those, the real testing that we need to do on a broader basis. And just want to add that for the issue of coordination, both at the at the state level particularly, have been raising that since March. That is sort of the question of the day, but it's extended for many, many months. And I would love to engage in any conversations that are able to answer that question in some way. So thank you.
Great, thank you. And I think Commissioner Stegman had similar questions as well, so we will.
Yeah.
All right, Kim.
Okay, I just wanted to give a brief overview of outbreak sites. I know that people may have questions about this, especially since we've moved into phase 1. And so this is just a list of different types of facilities that are either just regular work sites and or places that are work sites and people live there as well, residential facilities. Food processing is not restaurants. It's the places that food is processed and canned and bagged and repackaged, frozen, et cetera. Childcare, we're starting to see an increase in outbreaks since childcare with phase 1 had more of a reopening. These now are 7, and as folks are probably well aware, there's many hundreds of childcare sites. So keep that sort of proportionately in perspective. We always just look at healthcare clinics and hospitals uniquely just because of risk to patients. Those are being managed well right now. And then the general work sites, we've got 19 going on right now. So you can see that there's a significant, if you look at all the different sites that could have outbreaks, there's really significant representation among the residential facilities as well as the food processing plants. And those have some unique considerations at both of those sites in terms of risk, in terms of people who get it, and if it gets into community spread or not, and or in terms of like for the residential facilities, the level of severity of disease when you have folks who are already older and medically fragile obviously is really high. So what I will say is that the outbreak numbers overall are increasing in number, but the size is generally quite small. Often there's fewer than 5 cases per outbreak. Our threshold right now is very low for calling something an outbreak. It's 2 or more cases. And I think it will be helpful that in the gyms specifically, people need to wear face coverings because some of the assessment we do of risk for if customers of work sites have been exposed as businesses start to reopen to on-site customer access is how long were they in close proximity to each other? Were 6 feet of distance maintained? And if it's a business site where people would be expected to be in there longer than 15 minutes, were they wearing a mask? So all those things to mitigate risk in those settings are actually really important. You've heard that every day from us, so I'm sure that that's not news to you. The childcare and the restaurants, I would say we have just a small handful of restaurants as well where more than one staff person has been ill. Most of those are closed for 2 weeks so that all the employees can quarantine and do a deep cleaning before they reopen. And we are continuing to support different work sites, especially those that are at higher risk. So the residential facilities is the next slide. And I'll just say that shelters for folks that don't have housing, homeless shelters and corrections are 2 residential facilities. There are no outbreaks in either of those. I just gave a list of the types of adult care settings that have had an increase. Like I said, we continue to work with them to arrange testing for residents and staff if needed, coordinate with Department of Agriculture or DHS or the Oregon Health Authority for inspection and for recommendations, as well as support those facilities if they need more protective equipment and gear for staff and residents than they have. We will help them access that. So with that, I will turn it over to the next speaker.
Thanks, Kim.
Can we go to the next slide?
Oh, this was another Kim Taves slide.
I just wanted to briefly show the work that we're doing in our department with contact tracing and case investigation. That shows, the blue shows you the number of cases reported, which I mentioned at the beginning when I talked about the case counts going up. And then we've got the red being our metric for cases called within 24 hours. And the yellow is what we think is maybe a little bit more impactful metric, which is how many folks do we actually reach for interview. And so what you can see is we were really doing quite well until this last week. With that huge increase, we're still training our new staff, so not all of them are taking cases yet on their own. They're still shadowing people. So we did have a gap, and people may have experienced that themselves. If they were a case in the past 7 to 8 days, there may have been a couple days before they heard from public health instead of just hearing in a day. We've also seen that there's a bit of a lag in labs getting reported to us directly, and that's not an internal problem with us. That's about the lab reporting system between hospital and health departments. So we'll be trying to work on that as well. I expect that our metrics will go back up over the next couple of weeks as we have more staff that are fully trained and ready to take on cases, unless the cases continue to increase the way that they have in the last 10 days. Then we are looking at ways we can expedite certain parts of the process, but I just wanted to check in about that infrastructure. All right, now I'm done.
And now it's Chris Voss.
Yes. Chris Voss, Director of Emergency Management for Multnomah County, KECAM. And so I'm going to provide just a quick update on PPE and sort of our ongoing efforts to sort of push out those supplies to our most vulnerable populations. So this first slide is just a week over week overview of sort of how much we're pushing out of our 3 most commonly asked for.
Chris, your audio is really choppy, FYI.
Okay, I'll try to get a little closer. Hopefully that'll be better. I am working from home today. So is that any better? Yes? No? Okay, hold on 1 second. If you bear me 1 second, I could actually, we've got a second computer here, and then hopefully that'll be, we'll see if this works. Sorry about that. Thought I had tested that video beforehand. Okay, it's not letting me. Okay, please bear with me then. I hope this, and please, and you can also give me some questions afterwards if you need to. The first is just a rundown of supplies. Last week these are the 3 most commonly asked for supplies, and to just give you an idea of how much we still have left. We have just over 1 million procedural masks, So that should still give us a decent amount of supply for the next couple of weeks. And then we still have several thousand gallons of hand sanitizer as well. So we are looking okay here. I did want to just from a broader standpoint, since the start of this event, we've actually distributed about 4 million masks. About 2 million of those masks alone went to hospitals, just to give you the volume of PPE that we are dealing with and supplying. Next slide.
Chris, maybe it would help if you turn off your visual so we can just have the audio. That might help. Not that we don't want to see you.
All right. Well, I promise I won't be completely offended by that.
Actually, it's better.
Okay, here we go. And so so my last comment was just in procedural masks alone and KN95s, we've distributed about just shy of 4 million since the start of this event, with about 2 million going to healthcare facilities, just to give you a sense of volume. But this gives you a brief breakout of the KN95 and procedural mask handouts just in the last few weeks. And you can see we continue to target the 3 key groups. It is organizations serving people with pre-existing conditions, over 65, and communities of color, which is actually the largest grouping of where we're handing out masks. Hopefully my sound is a little bit better. I just had 2 quick slides to give you a brief update, but I'm happy to take any questions, and hopefully you'll hear me if hear my answers.
Yeah, we'll run down the questions real quick. Commissioner Stegman?
No questions.
Commissioner Vega-Peterson?
No questions.
Commissioner Jayapal?
No questions. Thank you, Chris.
Commissioner Myron?
No questions. Thanks, Chris.
Thanks, Chris. And I do think something's up with your mic, so we might want to get that tested. Yep. All right, next slide, please.
Hi, everybody. This is Jessica Guernsey. Can you hear me okay?
Yeah. Welcome, Jessica.
Hi. For the record, my name is Jessica Guernsey. I am the Deputy Director of the Public Health Division. I use she, her, hers pronouns, and I'm also the proud mother of a incoming junior at Franklin High School, Lorenzo Tomas Camargo Guernsey. He may be out there listening. If you are, hi, Lorenzo. And his teachers. I understand some of the Franklin staff are listening in today, so this is exciting. So thank you for having me today. I'm going to talk a little bit about a sliver, I will say, of the issues related to schools reopening. I'm going to talk a little bit today more about the what I would describe as the tactical side of supporting the considerations related to schools reopening. So this isn't the larger questions of what to do sort of at a community level. This is more bringing folks up to speed on what we're doing to support the planning that needs to be in place regardless of when things happen. So first off, there's a lot of people to thank, which I will do through the slides, but I definitely want to, on the front end, thank our ESD, Multnomah Education Service District, MESD. We're so lucky to have such a strong public health partnership with MESD, particularly through our communicable disease and STD program, KIMS program. We work every day with them on work like this. This scale is a little bit different, obviously, but we have been leaning quite heavily on that partnership. So really want to call out MESD on the front end. Excuse me. I'm going to walk through a couple slides. This first slide is from the state schools reopening planning document. Our public health director, Ms. Rachel Banks, is on the group at the state level that is providing advice and public health and community thinking for the statewide process. So this is just a visual from their planning documents that represents the continuum of learning models that are being discussed on a variety of different inputs and issues. Next slide. And the council, what they are charged with, there's a variety of different pieces that they're talking about, advising on equitable policies and practices specific to school reentry and operations, informing the guidance as it shifts over time. There were a couple changes that came out this week, ensuring coordination and alignment between K through 12 schools, guidance, and other related public health and education sector guidance, which is quite a lift. And then receiving ODE updates on school district operational plans, as well as receiving epidemiological updates and status reports on regional health metrics. So this is the overarching Governor's Healthy Schools Reopening Council, which Rachel has a seat on at that table. Next slide. This is just the cover of the plan. Ready Schools, Safe Learners, guidance for school year. Next slide. So to go into detail around our process in Multnomah County, we have about 200 public schools and then 45 private schools. And I'm going to walk through some of the specifics of our process for the plan review. So as part of the state plan, each school has to develop a plan that for our piece is really centered around communicable disease and outbreak response for the public health component. There's obviously other pieces that are needed depending on where people land on the continuum of distance learning or in-person learning, but we have the responsibility as the public health authority to review the communicable disease and outbreak components. So here in Multnomah County, we've put together a very robust public health review team that includes folks from our Multnomah County Emergency Operations Center. And I really want to give a shout out to Tiffany and Greg in our EOC who have been burning the midnight oil to pull this all together. So big kudos to them. And we also are working closely, as I said, with MESD, but also our Deputy Health Officer, Dr. Ann Loeffler, our communicable disease team. But our panel itself includes folks from our school-based health centers, our fabulous Sun schools, our adolescent health programs, and staff from environmental health. So some of our inspections team and plan review teams. So we have a very robust team that is pulling together next week to do a training with our communicable disease staff to walk through the components that we're responsible for reviewing. So we are starting to get a trickle of plans come in, just a handful at this point, but we fully expect getting a pretty large bolus of plans close to August 15th, which is when folks are supposed to submit their plans to us. They're supposed to post them on the state's website, and they're supposed to submit it to the state as well. Next slide. So I'm going to talk a little bit more about the plans. These are obviously central to any type of schools reopening plan, regardless of when it happens. I just want to emphasize that. Our partners at MESD have built a template that it's been a iterative process with curriculum directors from the school districts and public health as well, but really MESD in the lead. And it's built off of long-standing existing communicable disease work done with the schools. And this will provide the backbone template for each district school plan so that folks, we fully expect that people will use this as a roadmap for what they're already doing. So it isn't creating something from scratch. The other thing that I wanted to mention, in addition to the template and the review process, two other things. Our colleagues at in the Sun School system have graciously offered to overlay our Multnomah County racial equity lens tools across the planning and review process, so that when we do the team review, we're using an equity lens each step of the way. There are things that are built into the plan overall, more on the education side, that require schools to report to how they're considering racial equity. But we are also going to overlay our own tools on that as well. The other thing I wanted to mention is in working with the schools over the last several weeks, it's been really clear that we need a strong and coordinated communications approach. Obviously, some of this is already happening. I'm getting lots of emails from Portland Public Schools that are very specific around what they know at this point and assuring parents and community members around what is central to their plans. But we are also going to be pulling together a communications team next week to help pull together different tools that a lot of it we already have, but pull it together in one place, kind of like we have the toolkits for businesses and other specific groups so that we're prepared for unified communications. We're really excited because we're going to be joined by 3 or 4 youth from our youth liaison group that's housed in the Multnomah County Emergency Operations Center. So we will also have a youth focus on our communications team. Next slide. So I just wanted to go over a little bit around the specifics of what's included in the public health component of the reopening plan. Like I said, the full plan includes, educational continuity and lots of other stuff. For our pieces, these are the things that we're really focusing on. They're probably semi-self-evident, but I just wanted to go through some specifics. They include things like physical distancing plans, protocols for PPE, cleaning protocols, cohorting, including attendance logs and movement logs, which will support our outbreak response, public health communications protocols, and then plans for various services such as meals. So these are the other things that happen in the schools that aren't just in classroom education. I think that wraps up the slides that I was presenting to. I know Kim has another slide in here that is the pediatric epi, but maybe we should, do you want to take any questions? Or?
Yeah, thank you, Jessica. Let's pause for questions on what we know about the school's plan to date. And we will go through the commissioners for questions. We're going to start this time with Commissioner Myron.
Thank you, Chair. And I just want to say a particular thank you to Jessica. I know that I think Katie had talked to you in some depth about this planning process, and you have been doing such an amazing job. And I just want to let you know how deeply I appreciate the work that you are doing on this and for your presentation, which was really helpful and clear. And I have one question and wanted to, and then just wanted to make a comment. The question is, where do in this sort of whole continuum, where do the schools and the districts get their public health guidance, not whether they comport necessarily with one of the plans or the models, but which one they should do? Like if they feel that they need help making some of these decisions, did they turn to us? Do they turn to the state? How is that addressed? Because I have heard from some district people that they just don't even know where to go to make these decisions.
I can certainly answer part of Deborah.
And I can also answer. Like I'll start, Jessica. You can, and Rachel can come in. We're still working very closely to influence the states. We're in our team at many different levels are working closely to try to get more clear direction from the state. And I'm actually anticipating that next week the state is going to release some further guidance and criteria. It's definitely not ideal. I don't think there's anybody out there that will say that this is the way that should or best way to get things done. But it is what it is, and we're trying again at different levels from the political level to the health department director level to on the ground to the superintendents who are working with the state. So there's many different modes of communication. And Jessica, or Rachel, do you have anything else to add to that?
I mean, I would just say we are currently, consulting with schools and districts right now. So we have as I mentioned, one of our fabulous liaisons in the EOC, Greg from the Sun Schools. We have regular calls. So we are constantly providing support and information to the school districts and some private schools. And we get technical questions all the time that we are available to answer. I think to the chair's comment, there's still a lot of, unanswered questions from the state direction that need to be answered. But at the moment, we are real-time answering questions.
Thank you. And
we're working really, I also want to just reiterate one more time, we are working extremely close with the school districts, all of them in Multnomah County, and actually at the tri-county level as well, because we understand that, our region is in this together as well.
Yeah, thank you for that, Chair. So I do just want to state for the record that I feel that we are in no position to be opening our schools. I can only speak for PPS. We are in no position to be opening our schools for in-person learning in any sense in the fall, and to be spending time trying to sort through that and operationalize a complex, difficult, challenging system when the reality is we shouldn't be doing it. Our schools aren't ventilated, no matter what we do about distancing, PPE, cleaning, et cetera. With what we know about the virus now, it should just not be done, period. And so rather than waiting until mid-August, when every parent I've heard from, teachers are struggling to plan and figure out what they're going to do, I think that's where we should be putting our resources, hoping that the state will come up with some guidance. And really, I am laying this at the doorstep of the state. My deep frustration, I do have to express that and say, we should be working super hard right now, just not on the communicable disease and outbreak component, which obviously is what we need to be doing. There needs to be work on a comprehensive curriculum that is distance learning at the districts. And for us, we need to be putting the supports in place now and be proactive so they are ready to be implemented when we hear ultimately that the schools aren't going to be open in person, because ultimately that's probably what's going to be happening or should happen. And rather than delaying it and then reacting, it would be better to be ready to support our people, our parents, food, child support, whatever those wraparound services our families need, so that we are in front of this rather than reacting and getting our students, my kids are PPS students, the actual real curriculum that they need. And we've had since March, we haven't done it. And it's just, I'm sorry, it's just very, very frustrating and upsetting. So had to state that for the record. Thank you.
Thank you. Commissioner Jayapal?
Thank you, Chair. Thank you, Jessica, so much for the presentation and all of the work that's going into this. I don't have any questions about our sort of public health role in this process, but like Commissioner Myron, concern, adding on to what Commissioner Myron said, sort of just a reminder that we have to look at the other pieces of reopening or reclosing in conjunction with the school piece. I mean, my concern is that if the decision-making at the state level isn't taking into account the considerations, we could, for example, keep the schools closed, have businesses continuing to operate, and families whose parents are in front lines or otherwise compelled to work. And then they're in this impossible situation where There's a set of decisions perhaps being made on the basis of the economy. There's another set of decisions being made for schools legitimately for public health reasons. And those two pieces aren't connecting. And we've got our families, particularly our BIPOC families, falling between those cracks. So really, not a response to your presentation, but as we continue to work with the state on all of those levels, I think we've got to be keeping all of the pieces interconnected as we go forward. Thank you.
Thank you. And we do have a larger role than just public health in this. We do have our school-based health clinics. We do have our Sun schools, our libraries, our early learning. I mean, we touch school-age children in many, many different ways. And I think Kim Melton was going to hop on here if she can.
Hello.
A comment? Yes.
Can you hear me? Oh, hi.
Go ahead.
Kim, for the record, Kim Melton, she, her, hers pronouns, chief of staff, chair's office. I did just want to say, I do, as we're kind of, I think today talking about our public health role, which is really critical. I did want to at least raise and kind of assure that the Multnomah County as a county government who operates both providing basic needs, prevention, safety net services for families, like all of those things all sort of work in concert. And so we're at this, and I think that was part of also the genesis of having a team that was connected to our public health plan that also reflected all of the different types of work that we do with young people in adolescent sexual health, as well as with SUN and with school-based behavioral health and the school-based health centers. And those entities have been in contact and been talking with our school districts as well around what ways we can be creative, rethinking what we do, because this school year is going to be like none other we've had before, and maybe like none other we will have again. And so going into it with the idea of what will it take to sort of be a support to children and families in this space, which is both about where we have assets and skills, but it's also how we're tying those together with the kinds of youth support, like youth advocacy supports, as well as mentoring, and as well as making sure that that ties in with our food access and our rent assistance. So I do want to say that I think we're focusing right now on what is sort of the preeminent set of decisions and activity that's really an increased workload and increased sort of workflow for us and as sort of the local public health authority, but that's not without sort of thinking that we have to be working in concert with ourselves so that any plan, particularly a plan that's an online centered plan, will have to answer questions about how we support young people who might be in behavioral health crisis or might be in experience trauma, and what does that mean for their families. So I just want to raise that those are also questions that we're trying to engage in across the county, and hopefully there'll be more coming on that as we increase conversation there.
I really appreciate all of that, Kim. And I think my comments were also focused on that even more macro level of policy about reopening the economy, reopening our community, and needing to have all of the pieces of that work together. We can support in all of the ways that we support. And if families are squeezed between job and not job, we can't address all of those other issues. So, but I appreciate your comments. Thank you.
And the federal government needs to continue to actually to step up and actually pay people who are not able to work right now and keep them from being evicted from their housing. So many ways, there's so much to do. Commissioner Vega-Peterson.
Thank you, Chair. I mean, thank you, Jessica, for all the work on this. I also, just appreciate the way that there's been so much discussion around this and really thoughtfulness into how we're doing it. I have to say, I really support what Commissioner Myron was saying, though. It's really, it's really hard when you think as a parent with, 2 school-age children that, that there's so many unknowns right now about what this could look like, but what the data is telling us in terms of the cases are on the rise, that it's impacting younger and younger people across the board. Those are raising red flags. And I get that there are so many hard things that we have to balance in terms of making these decisions, like online access and equitable access are really big ones if we're going to be not going into schools, but I think we're going to end up in that place anyway. I think that regardless of even if we try to open schools, I think we're going to end up in an online only. And so we should be doing the work now to make sure that we're prepared for that. And we are getting the tools and the resources needed in the hands of those families who need it the most. And I also think absolutely, like, we have to consider the workforce implications for parents. I had my camera off earlier because my son needed to log into his online camp, so we are every day having to figure out how to balance these things. And we need to be having those conversations now, and we need employers to really be engaged in those conversations. And I'm just afraid that, mid-August is going to be too late. I had an email from my children's school saying, let us know if you're going to be going online only, if you want to do the hybrid model. And I'm like, that totally depends on where we are health-wise. And so, we're asking individual parents to try to make decisions without really having broader guidance about it. And that's really what we need now. So I'm encouraged to hear that the state might be giving more instruction next week because it can't come too soon, I think.
Thank you. Commissioner Stegman.
Thank you, Chair. My question, and I think you probably have all answered it to some degree, but I was wondering what is our authority? Are we the gatekeeper if we say, as a public health authority, we don't feel it's safe? Or are we more like just providing recommendations? I just didn't know what our legal and our public authority is, or maybe that's what we're trying to determine.
Yeah, I think it's not, unfortunately, Commissioner, it's not as simple as what is our legal authority, because there's also, the school districts actually are working with the state, and we're working with them at many different levels. So I would say, well, I think everyone's raised really, really important points right now. And school districts are currently working on 2 tracks. They're working on the hybrid model. They're working on a fully distance learning, and some of them, depending on where you are in the state, or have different health results right now. So, people are in different places with this pandemic as well. I don't know that it's just as easy as saying, yeah, we can do whatever we want, because that's not the case. This is people having to work in partnership and address all of the things, I think, especially that Commissioner Jayapal talked about. It's not even just about whether or not kids are going to be in the classroom at all. It's about how are we going to support the families who still need to go to work with their kids. So we're really looking at all of those angles right now. And I will just end with what Kim Melton said, which is hopefully we will not be in this situation next year. That's kind of my words of how we're going to get through this. But we will continue to have more conversations about this topic, as well as, and I know that this was primarily focused on our public health lane. We do have many other lanes, and we're going to continue to talk more about schools, as well as how the other pieces of this pandemic. But this was just to tell you where we are as of today. One thing is certain during this pandemic, which is that everything will change, and I'm sure by next week we will be having a somewhat different conversation. Hopefully not completely different, but somewhat different. So thanks, everyone. Thank you for all of your questions and comments today. And we are, that's right, we're in our regular board meeting. So we have come to the end of our board meeting. And so we have time for non-agenda item comments from the board. So we're going to go through commissioners, starting with Commissioner Myron. Do you have anything for the good of the order?
No, thank you, Chair. I think these I've really appreciated. Well, yes, yes. I really appreciate these conversations, and I just wanted to bring up what has been happening downtown and the protests that have been going on, that have been getting larger and larger, and I think that it has been an incredible showing of people that say that's federal occupation of Portland and firing tear gas and projectiles, et cetera, inciting violence against, by and large, peaceful demonstrators is not acceptable in our city, in our country. And I will be going back down tonight, and we'll probably be with the Wall of Moms. And I know we're all moms, but if anyone would like to join me, I would love to connect and go down together. So, or meet up or something. So I will be there.
Thank you. Commissioner Jayapal?
I think just to add to what Commissioner Myron said, we're obviously dealing with the federal government engaging with those behaviors, and in some ways that masks the fact that the response was the tear gas. All of those tools were being used before the federal government arrived. So we've got layers upon layers of complexity that's happening down there. And Commissioner Myron, I would be happy to join this evening with the Wall of Moms.
Commissioner Vega-Peterson?
Thank you, Chair. Yeah, thank you. I think, it's incredible what's happening right now in Portland, and the way that the intention of the entire country and the world is on us because of really the actions of the federal government. And I'm really proud of the protests that are happening. I would have to say that I also think it's so important that we continue to center the Black Lives Matter message and substance of how this all started, or that we're continuing to center the voices of our Black community members and what they're looking for, and not because I think that part of the plan of having all the federal officers here and not removing the graffiti from the federal courthouse building, even though it's off of other buildings, is to really try to draw attention to the fact that there's unruliness here, when really this is all about Black Lives Matter and the investments that are needed in the Black community, and we need to continue to uplift that message and center those voices as much as possible in this.
Thank you, Commissioner Vega-Peterson. Commissioner Segment?
Thank you, Chair. Last night, I had the opportunity to attend a counter protest in the city of Gresham. There was a group of folks that were protesting the Black Lives Matter flag that is currently flying at City Hall. And the Wall of Moms were there. Thank you so much for being there, and Stand Up Gresham. My personal experience there last night, there was a group of people that a gentleman had a gun. Another one was wielding a knife. And these were folks that were protesting the Black Lives Matter flag. I was deeply disturbed by the public safety response that was more directed against peaceful protesters who were supporting the Black Lives Matter movement. And I am really looking forward to having some deep conversations about how police respond to civil, peaceful protests, not only in the city of Portland, but in the city of Gresham and all of our East County cities. So I agree with you, Commissioner Myron. I will be downtown as well over this weekend. And I really seen firsthand, it was really horrifying, because there was a group of people that were peacefully protesting, and all of a sudden people started running and people were screaming, "He has a gun." And what was so disturbing is that the public safety response was not to protect the people that were running away from an armed man, but it was to protect a person who was armed. So I think it is incredibly important for electeds to see firsthand what is happening in our cities. And it is deeply disturbing, and I am really calling and demanding for there to be change as well.
Thank you, Commissioner Segment. Thank you to all the commissioners for your comments this morning. And to end our meeting on a happy note, I am really excited, as I know that you are all as well, to welcome Gresham's newest city councilor, Vincent Jones Dixon, who is the first Black elected in 3 decades So we are very excited to welcome him. Many of us know him and know his family, and really excited to see that change is occurring. And we look forward to working with him in his new role. So that's the end of our board meeting. I want to make an announcement here that our board briefing on Tuesday is going to start at 9 a.m. instead of at 10 a.m. So mark your calendars, and we will see you all back here at 9 a.m. on Tuesday. Take care. Thank you so much. Stay safe and stay healthy.